As the World Health Organization stated, health is not only physical fitness, but it's also the mentality and social well-being. In other words, a healthy person will be considered as their three aspects are met. Therefore, the ways that the care provider treat the patients really matters and really important. Because of that, Mary Free Bed Rehabilitation Hospital becomes our choice because of its profound caring as well as diverse communication. So today, our group, me, E, Lauren, and Price, will bring to you an overview of Mary Free Bed Rehabilitation Hospital with three main things. So first of all, we will talk about what or who is Mary Free Bed. After that, we will touch on the communication concept used by Mary Free Bed. And last but not least, we will deduct the lesson that we learned from the Mary Free Bed. So first of all, what is Mary Free Bed? Mary Free Bed was established in 1891 with a really unique idea. So at that time, a group of women, they want to establish an organization to help the individual through caring. So they asked somebody to donate 10 cents of anyone whose name is Mary. And because of that time, Mary was the popular name. So they raised the fund really effectively and profoundly. And because of that, they established the Mary Free Bed and the way that they can help people through caring and to rehabilitation. Day by day, this organization grew up effectively and tremendously. And right now, Mary Free Bed has the main campus, Grand Rapids, and this also has location in Indiana and across Michigan, and it's actually a really famous organization for the health field. With the focus is the acute care through various therapy, including speech, physical, and occupational. Going deeper, we will look at the mission, the vision, and the values of the Mary Free Bed. With the mission of restoring hope and freedom through rehabilitation, we can see that Mary Free Bed really places the patient as the first choice. They always put the patient's preference as their priority. And with the vision of the national leader in high-value rehab and post-acute care, and to develop an integrated system of care, their vision is they really want to make Mary Free Bed becomes a home to the patients. They want to make patients feel really relaxed and really enjoy, and do not feel like this is the place where they have to face also treat their illnesses, but like this place where they can be the home, they can be the family member. And all of that is go to the values of the Mary Free Bed, which include collaboration, innovation, diversity, honesty, healing, and joy. And it's actually really true about Mary Free Bed. So with this value, Mary Free Bed actually has a various of communication style, but they chose interpersonal communication as their main things. And because of and that, here we will present to you a short clip of the Mary Free Bed.
I drive 216 miles, that's how much I tested.
Back driving and back to work, and now I'm halfway running. Instantly, when I got here, even the welcome was like a lean towards, okay, now it's time to start pushing. And whatever you want to be, you can be it. Whatever you want to be, you can do it. Mary Free Bed is kind of restoring the fact that that's true.
And as we can see from the clip, people are really close to each other, and it was a really nice relationship between the care providers and also the patient. And right now we will jump into the communication concept presented by Lauren.
Moving on to the communication framework of the Mary Free Bed Rehabilitation Center. The first perspective that we will be talking about is the biopsychosocial perspective. With this perspective and good interpersonal communication, one can ensure that the Mary Free Bed Rehabilitation Program ensures all of their communication goals. As it was mentioned, this perspective takes into account not only the patient's physical conditions, their thoughts and beliefs, but their social expectations as well. Being that this organization values interpersonal communication, the biopsychosocial perspective is incredibly important. To relate to a real-world example, we had an interview with Ashley, who works for Mary Free Bed. She said that when talking to a patient, honesty is incredibly important. You want your patients to trust you, and the only way they will be able to do that is if you are honest and open with them. When you're talking to patients, it is very important not to look down on them or to talk down on them. You want to be at eye level when communicating. And additionally, you should ask your patients for both their names and their pronouns, as well as when talking about difficult subjects, avoid medical jargon and ask for patients' understanding. Another perspective we will dive into is the intersectionality theory. This theory states that a person's social position reflects multiple factors in their lives, and that it is of greater importance for healthcare workers to familiarize themselves with the patients rather than to make assumptions about them. This is especially important when communicating with someone with another culture. Once again, in our interview with Ashley, she states that when she's communicating personally with someone that is of a different culture than hers, she heavily reads the patient's chart before she enters the room. She wants to make sure that she knows everything prior to going into the room, and if she has any questions on the chart while she's reading it, that will be one of the first things she does to get clarification upon entering the room. Additionally, while discussing with patients of another culture, if confusion arises, it is important both for the patient and the practitioner to ask questions. You want to make sure there's a mutual level of understanding for both parties, that way everybody is getting the best outcome. Another additional thing which is important that Ashley mentions when communicating with another culture is one should be candid and open with the patient. Trust is something that is incredibly important, not only with patients of another culture, but with all patients in general, and one will not establish that level of trust without being open and candid with their patient about their medical needs. An additional communication concept that we will be discussing regarding Mary Free Bed is the theory of mHealth. So this theory is the belief that health apps are rich in content and they engage users, compelling them to share knowledge with others. Sharing leads to support, feelings of self-efficiency, and social norms that facilitate healthy behavior and better health. Mary Free Bed does an excellent example of incorporating mHealth into their program. For example, they use the MyChart. If you are unfamiliar with MyChart, what one can essentially do is you can schedule your appointments, view your doctor's notes, your past and present medications. You can reach out to physicians if you have any questions, view your bills. Essentially, it takes what used to be a call and turns it into something one can do on their phone, saving themselves time and patient time. Now we will be moving back on to discuss what we have talked about thus far.
What we have learned from Mary Free Bed is really meaningful. So first of all, from what Lauren just explained about the communication concept, we can see that the interpersonal communication with the intersectionality theory help us to engage the power of trust of everyone. So like Mary Free Bed, they honestly talking to patients and they gently ask them the private question to actually understanding, share more things with them, and that is the power of trust. They engage the trust in the patient, not only not treat them like the care providers and the patients like merely, but actually they truly understand about them. And the next thing, as Lauren mentioned, they always honest speaking and genuinely listen and also politely persuade. So that is the core communication style that we really need to enhance in our daily life. And so I would say with the unique idea to establish the merit-free bed that I mentioned before was the really deep communication concept, including intersectionality theory, and also the way that they virtually communicate with patients through the mHealth, which is my chart, really help us to know that merit-free bed is a truly successful organization, not only in the health treatment, but also in the communication with the patient. And with all of that, what we can learn is to communicate really profoundly and genuinely. And if we can do all of that, we all can blossom the connection among human beings. And that is all about it. Thank you so much for your listening.